a mandatory vaccination policy for healthcare workers, paramedics, teachers, and others. And given the news out of other provinces, there's been a lot of interest in what the vaccination rates are for these sectors here in Nova Scotia. Of course, the November 30th deadline is approaching. We've received preliminary numbers from healthcare workers at Nova Scotia Health and the IWK, from paramedics, and also from staff at long-term care homes and home care agencies and teachers. We haven't heard from everyone. We're still collecting data, but the results that we have that have been reported to us are encouraging. Of the data we collected from the Nova Scotia Health and IWK employees, those who reported, the data we have, 91% and 99% are fully vaccinated. That's the Nova Scotia Health and the IWK. The data we have for long-term care workers is 85%, and only 67% for home care workers. So the 97% are fully vaccinated in emergency health services, and teachers are at 99%. So that's a lot of numbers. They'll be in the release. We're still waiting on more long-term care numbers and home care numbers, and we'll update you as soon as those come in. But the priority now is to track down and identify workers who that employers haven't heard from to determine their actual vaccination status and or their intentions. Employees who have not reported will have to take a mandatory education program. If they are willing to be vaccinated, we will work with them and we will help them have all the information they have to take that step. This is all about protecting Nova Scotians. It's not about penalizing the people who work in some of our most important sectors or putting services and supports at risk. It's not about that. But with that said, we fully expect that there will be some who choose not to be vaccinated. And that is their personal choice to make. But we need to closely monitor that number and understand the impact that it could have. If sectors need support after November 30th, we will work with them. No one wants to see service disruptions, but more importantly, I don't want to be offering condolences to any other family members who had a loved one taken by this virus, especially if their loved one contacted COVID-19 from someone in a hospital who was, as an example, who was unvaccinated and caring for them. That's just not acceptable. So we continue to encourage people to get vaccinated, and I'll turn it over to Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And I do want to offer my sincere condolences to the families of the 3 individuals who have recently passed away due to COVID-19. So as of today, Nova Scotia has 220 active cases of COVID-19. The increased case numbers we are seeing are from several clusters of cases, primarily in the northern and western zones, related to several faith groups that participated recently in a single multi-day event. And we are now seeing further spread within each of these faith group communities. The majority of the cases involved have remained unvaccinated. Unfortunately, at this time, there is no indication of spread beyond these and these communities are closely following public health requirements for testing and isolation, and I want to thank them for their cooperation. There is also a cluster of cases in Central Zone related to a separate faith community that involves mostly children who are not yet able to be vaccinated. And I also want to thank the leaders and families in this community for their work with public health. And again, we're supporting those communities with enhanced opportunities for testing and vaccination as appropriate. But again, most of the majority of cases here are not yet eligible for vaccination. So the current situation brings with it an important reminder for faith groups in the province. Anything except a regular service, so that's Sunday church service, Saturday at the synagogue, Friday at the mosque, anything other than that requires participants to show proof of vaccination. So this includes things like Bible studies, retreats, youth groups, any other activities outside the regular weekly service does require proof of vaccination. And also, while in those services that do not require a proof of vaccination, it's important to a reminder that masks need to be worn at all times by the congregation. So in general, we continue to have contained clusters, but unfortunately, we are seeing some signs of community transmission in the Amherst and northern part of Cumberland County area as a result of the clusters in that part of the province. There have been increased opportunities for testing and vaccination in this area throughout the week, and they will continue over the weekend and into next week. So public health is watching this very carefully, and I am optimistic that as before, that our overall high vaccination coverage rates will limit any spread into the broader community. Now, I cannot stress enough the importance of people getting both doses of vaccine to further minimize the risk of spread of the COVID-19 virus in our province. Our case numbers and the spread we are seeing clearly shows what happens when people choose not to be vaccinated. So I'm cautiously optimistic that we are still, that this will remain to these focused groups, that we won't see spread to the general public. But this should be a reminder, if we need it, that we're still in the middle of a pandemic. We're in the middle of the fourth wave. We cannot relax. We still need to take this seriously. We need to get vaccinated, people following all the public health measures that are in place. They are working. They will get us through this, but we need to continue to be very vigilant and take this seriously. And give an update on our vaccination efforts across the province. We're at the stage in our vaccine rollout where outreach vaccine opportunities are a key strategy to increasing vaccination rates. Local public health outreach teams continue to focus on communities and areas with lower vaccine coverage rates to decrease barriers to successful vaccination. These teams have delivered more than 30,000 target doses of COVID vaccine, and their ongoing work is critical for Nova Scotians for Nova Scotia to reach the highest possible vaccine rates. They are working closely with community partners like family resource centers, high schools, universities, colleges, community centers, and others. And they partner with the public health mobile testing units to offer COVID testing and vaccine at the same time. And this increases access to testing and vaccine by meeting people in the communities where they live, work, and learn. This is difficult and tiring work, and I want to thank these teams for doing such important work. And I also want to acknowledge, I've talked this morning with the increase in case numbers is putting a considerable stress on frontline public health workers. They're working long, hard hours after almost 2 years of this. I want to acknowledge them and thank them for the work that they continue to do and recognize the stress and the challenge that the current situation is placing on them. Recently, the National Advisory Committee on Immunization released several recommendations on booster doses of COVID vaccine. In Nova Scotia, we have already implemented 2 of these recommendations. People who are moderately to severely immunocompromised are already booking 3rd doses, and the rollout of booster doses in long-term care along with flu vaccine is underway. There are 2 other NACI recommendations that I would like to address today and how they will impact our vaccine rollout. The first is that NACI now recommends at least 8 weeks between dose 1 and dose 2 to be optimally protected. We now know that an extended interval of at least 8 weeks provides more durable protection against the disease. So if you currently have a 2nd dose booked at less than 8 weeks, you can keep your appointment, or you can reschedule further out if you want to wait the 8 weeks. My recommendation is that you wait the additional time to maximize your vaccine's effectiveness. However, if you prefer to get your 2nd dose sooner, you will still be very well protected. The second group of NACI recommendations I would like to address are the booster doses for specific ages and populations that were announced by NACI last Friday. Nova Scotia will implement all of these recommendations that, as I said, were released last Friday. And these include booster dose intervals of 6 months after the primary series. So all of these people, it's important, people who are eligible for the boosters, that you have to wait at least 6 months from your second dose before you can get your booster dose. And that's important to remember when you soon will get the opportunity to go in and start to schedule your appointment. It also means that naturally those who we had made a priority in our sequencing for the first series are going to be first in line for their booster dose. So the 80-year-olds will naturally be ahead of the 70 to 79-year-olds because they were first in line for their primary series. So we are going to start to offering booster doses for the following groups: people who are 80 and older, and then people who are 70 to 79. Adult frontline healthcare workers who received their primary series less than 28 days apart. And that's the majority of our healthcare workers that we immunized in December and then January into February, who are frontline healthcare workers. We were using Pfizer, and the recommendation at that time was 21 days apart. So they're all will be eligible now to get an additional booster dose vaccine. People who have received 2 doses of AstraZeneca vaccine or the 1 dose of Janssen vaccine, it's recommended that they now get an additional dose of an mRNA vaccine. And in Nova Scotia, people who are in either of those situations will now be eligible for that additional dose of an mRNA vaccine. Because of, as I said, the sequencing, when we started the program, we started with healthcare workers. So we are going to be rolling out the booster doses in the coming weeks, starting with eligible healthcare workers, followed soon by anyone who's 80 plus, and then 70 to 79. And like we did with our first and second doses, we are already in discussions and working with our Indigenous and African Nova Scotian communities to determine the best way to roll out booster doses in those communities. We expect to be able to start offering appointments for these boosters by the end of November. Teams have been actively planning and working out the logistics to deliver boosters within the community, and while our IT experts make the necessary technical changes to our successful booking and data collection systems. And we will share more information as soon as possible, including the specific dates that eligible Nova Scotians will be able to start booking appointments for booster doses. And as we prepare to administer booster doses, we also expect to hear more about the vaccine for children 5 to 11. Approval from Health Canada and recommendations from NACI are anticipated by the end of this month. And so I think it's a fairly clear that we need to be prepared that it'll be early in December when we start to, based on the national recommendations, before you would really start to be able to provide vaccines into arms for kids 5 to 11. If it happens a little sooner than that, based on national recommendations, we'll be happy to have that. But I think a reasonable expectation for families and parents, it'll be early in December before we actually start to immunize kids. And although we will be rolling out booster doses, our first priority will be to get vaccine into the arms of those who are unvaccinated, children 5 to 11, and anyone else who has only 1 or no doses of vaccine. Boosters may provide an added level of protection, but our first priority and the best way to reduce the spread of the virus to ensure that everyone who can has their primary series of 2 doses of vaccine. There are about 65,000 children in Nova Scotia who will become eligible between they're in the 5 to 11 age groups. And we're working closely with our pharmacies who are prepared to move quickly to deliver a vaccine to the younger Nova Scotians. There have been some questions about why we're not planning to vaccinate children during the school day. Different jurisdictions are taking different approaches and doing what works for them. We firmly believe that relying on pharmacies as our primary and initial delivery mechanism is the right approach in Nova Scotia. Pharmacies have been a foundation of our overall vaccine program. And if not for them, we would not be in the position we are today with our vaccination rates. They're very comfortable with all the online booking tools and all the data entry tools that they have been learned to use over the last number of months. We have pharmacies in every community, and having them will allow parents the flexibility of booking appointments during times that work for their family and to be with their children during that appointment. But if we're not seeing the uptake we expect in a particular area, we will respond with tailored solutions like we've done throughout this pandemic. We'll be monitoring uptake, and local public health will work closely with the school community, and we'll use things like our mobile vans, other additional type of clinics, if necessary and if a different approach is required. So the next few months will be busy for our vaccine rollout and our immunizers. I want to remind Nova Scotians to be patient and to be kind to immunizers as they work as quickly as possible to vaccinate all Nova Scotians, whether it's their first, second, or additional doses. And in closing, I want to remind Nova Scotians that it's never too late to get your first dose of vaccine. You may look at our vaccination rate and think that it's high enough and that you don't need to be vaccinated. But the reality is being unvaccinated means being at risk and putting others at risk. We have 2 recent hospitalizations as a result of some of our clusters. Unvaccinated people exposing other people, resulting in those individuals going into hospital. So those are examples of how unvaccinated people put others at risk. It's not just about themselves. The Premier has given an update on the sectors who were required to be vaccinated by November 30th. And I'm encouraged by the results, but I want to speak personally to unvaccinated healthcare workers. As healthcare workers, our responsibility is the safety and well-being of our patients. That needs to be your priority as you make your decision around vaccine. For others who are not yet vaccinated, remember that your choice impacts others. We all need to do our part to protect ourselves, our families and friends, and those people in our communities who truly cannot be vaccinated. So I'm asking everyone to do your part for our collective well-being and not just focus on yourselves. Remembrance Day highlights the tremendous sacrifices previous generations have made for each other and for us, with many giving your lives. All we're asking for you is to get a proven, safe, and effective vaccine. Thank you, and happy weekend to everybody.
Thank you, Dr. Strang. Just a reminder, we'll take questions from the room first before we go to the phone lines. I'll open up the room.
Dr. Strang, as we ramp up the vaccination program, is that going to require drawing frontline staff away from their ordinary jobs again, or is this thing well established enough now that that won't be a requirement?
Given our numbers that we have, we know how many kids, and that we've looked at this carefully. We believe that, with our established mechanism with pharmacies, with the need to bring in secondary approaches with public health mobile vans, which is what we've been doing all along, it will be certainly sufficient. That's one of the reasons. Other models that people are saying, to do school clinics and stuff would require significant redeployment of staff, whereas using the primary pharmacy model, which is established, well shown to be how effective it is, does not have that impact on the rest of the health system.
And Premier, a staffing question for you. At 67%, what concern do you have that at the end of this month there's going to be a dramatic decrease in available home care services for people who are receiving that right now?
It's a concern for sure. I mean, we don't want to lose anyone working in healthcare, education, or any other sectors, but the mandate has been in place. We're concerned. We're encouraging people to, if they have a concern about the vaccination, to reach out. We'll try to work with them, and kind of alleviate their concerns, and hopefully encourage them to get vaccinated. I just had some updated numbers as the reporting was coming in. So now the number right now, and this will be in the release, I think, is of the reported, of those that have reported for long-term care, it's 93%, and in home care, it's 89%. So that's certainly up from the 67 number that you just referenced. But that's the reality. I mean, as the numbers come in, they're going to fluctuate. And we don't have every employer reporting yet. So number one, we encourage the employees to report one way or the other. Let people know. Don't hold back. And the employers will aggregate that and send it through. But the message remains the same. Please get vaccinated, and we want to work with you one-on-one if you have concerns.
So in terms of numbers, actual numbers, can you put numbers to the percentages so that so people can have an idea of how many people need to get vaccinated? I mean, I know in Quebec, they said the other day that about 3% of healthcare workers needed to get vaccinated. That translated to 14,000 people, which is not insignificant. Do we know those numbers for the percentages?
No, we don't know them, but I mean, we're kind of working towards them, obviously, as the deadline looms. But we're just kind of, the numbers we've reported are of those that reported. So there's some that haven't reported, and that's different we've kind of sliced it up pretty good in the release. But look, I can't say it enough, is the pressures on our healthcare system and the pressures on our classrooms and the pressures on those providing services in Nova Scotians are intense. So anyone that we lose it hurts our system. But there's contingency plans in place, and we're still remain optimistic that people will take that step and get vaccinated. But we'll try to get you, if we have more numbers, we'll try to get those to you.
But it's likely we're looking at still thousands of people.
Yeah, could be. Easily could be, yeah. Across all the sectors and employers, yes.
I just want to add, but remember, these are preliminary numbers. We've got the month of November where we have educational efforts, we have one-on-one sessions. So there's a lot of work between now and November 30th to actually, the number you're concerned about, to shrink that as low as possible.
Dr. Strang, given the outbreaks in the faith communities, why haven't those services at churches and the like been required to check for vaccination? And I mean, it seems to be one of the primary sources of spread right now.
No, this is a specific circumstance of a group of faith communities at a multi-day event. We are not seeing weekly services where people attending, and we've deemed them to be essential. And I firmly believe that people, those who are of faith, that attending their weekly service is critically important to them, and we've deemed them to be essential. And therefore they don't require proof of vaccination. And we're not seeing those weekly services popping up as sources of transmission. This is a different set of circumstances that is happening.
You said the communities are cooperating. You used the same language when in the outbreak in late September about a closely tight-knit community. It's my understanding, though, that community stopped cooperating. Is that true?
No, we work closely with our local public health, the MOHs. They were very cooperative in terms of supporting public health in our contact tracing, supporting people to remain isolated, remaining access to testing. We're getting the same cooperation.
Is it possible that there were COVID-related deaths in that community that have not been reported?
I'm not aware of, we would have that if there were deaths that came through hospitals, we'd be aware of those. If they'd gone through otherwise through a death in the community that's not explained is meant to go through the medical examiner's office. We've had no reports of any COVID deaths through the medical examiner's office.
I'm wondering about the nature of the gathering in terms of the faith groups involved. Are these people who have been told that they should not be vaccinated, or is this a matter of some people are vaccinated but most aren't, and the gathering caused the virus to spread?
So what we know is you've had a fairly large number of people from a number of faith organizations who were together at a multi-day event. What we're seeing now, as we look at the cases, that a significant proportion of our cases are people who were eligible for vaccination who weren't. So that's a challenge. And so but now but it's because they were together at an event, they went back to their home communities. We're certainly seeing spread within each of those faith organizations and the families and a community as they're together. But we're not at this point seeing spread. We're certainly seeing spread within those communities, not unexpected because they have high rates of people unvaccinated. But we are not seeing any indication so far of spread into the broader general community.
Are organizers of this faith event fined for not following the public health order?
we're not clear, we haven't said you can't have large retreats events.
Checking for vaccination, proof of vaccination, which you said is required for any event outside of a weekly service. So given that that didn't happen, should they not be fined?
We're working for them. What was their understanding of that? But I'm not so much focused. We are certainly, as I said today, I'm sending out communication to faith leaders across the province, clarifying some things. I'm more focused on moving forward and dealing with these communities in a constructive, positive way to control the outbreak, than to focus on what has happened and whether they should be penalized for that or not.
Given how the fact that kids' vaccines might be available in a matter of weeks and not months, what's the province doing to address vaccine hesitancy among parents?
We continue to have lots of information available. We're working now, knowing that we have a few weeks. We're working on a strategy with our pediatric colleagues at the IWK, the Faculty of Medicine. So we'll be having many of those leaders, and we're fortunate to have some national, international experts in our pediatrician community right here in this province. So we'll certainly be working with them and make sure that their voices are part of the conversation with Nova Scotian and Nova Scotian families around the importance of vaccinating kids 5 to 11 when they get that opportunity.
What's your understanding in the faith communities of this large outbreak of why they are hesitant to get vaccinated if there's large numbers who are not vaccinated? Do you understand where they're coming from? What's their belief around that?
I haven't talked directly to the community. I have some insights into that. I mean, certainly there's lots of reasons why people, a small percentage of our population overall, but still important, don't believe they need to be vaccinated. Some of it's rooted in lack of trust. Some of it's rooted in misinformation. Some religious communities have firm beliefs that they don't feel they from a biblical perspective they shouldn't be vaccinated. I'm not going to argue with them about that. I have a very different perspective, but there are a small percentage that, for a number of reasons, don't believe they need to be vaccinated. But that's why we continue to appeal to people to say it's not about it's not about yourself. It's about understanding the impact of you being unvaccinated, what that means to other people, and we hope that for the majority of people that resonates with them, that they have an obligation to care for others around them by getting vaccinated.
Dr. Strang, previously when folks would get their first shot, they would be automatically booked for the second shot. For people who are getting the booster, is there a notification for them for when their time comes, or are we kind of back to the beginning now where folks will watch for when the system opens up for them as they become eligible?
So part of what we're going to is that people will be communicating starting today with other different ways of who's eligible. They can then go online and book, but part of what we're doing is making the tweaks in the system. So if I, Rob Strang, if somehow I'm eligible for a third dose and I go on to book, it won't let me book until I'm at least at that 6-month mark.
Dr. Strang, regarding the recommended 8-week interval between vaccines, why is the province giving people the option to wait the 8 weeks or to go sooner if we know from NACI that that's the most optimal protection?
It's optimal, but it doesn't mean that 4 weeks doesn't give you very good protection. And there may be reasons why some people may want to or need to get that second dose sooner. So we want to give people the choice. As much as possible, like in a vaccine, we give people informed choice around things, so they will have that option. And again, it's very important for people. 8 weeks is optimal. 4 weeks still gives you very, very good coverage.
Regarding the outbreak at the faith gathering, has anyone died as a result, or how many people have been hospitalized? Can you talk to the severity?
My understanding, there's been 2 people, not directly, but 2 people because of linked from exposures from people who were at that event, now in hospital. We haven't had no deaths associated with these cluster or this group of outbreaks that we've had.
For clarification, you said the third dose for people with 2 doses of AstraZeneca. does that apply to people with one dose of AstraZeneca and the one mRNA, or what's
No, if you've had the mixed schedule, which the number of Nova Scotians had, first dose AstraZeneca, then we were encouraging people for mRNA. No, they have very good protection. It's just if all you've had is the so-called viral vector, which is AstraZeneca or Johnson & Johnson, if that's all you've had, then we know that you've got lower immunity than an mRNA, and NACI's recommendation is that those people then should have an additional mRNA dose of vaccine.
So they get the third dose right away, and the ones with mixed have to wait 6 months after their second dose?
No, they have to wait. If they had 2 doses of AstraZeneca, they have to wait for 6 months to get their additional mRNA dose.
Dr. Strang, is there a number of how many people were in attendance at this faith gathering that caused the clusters?
I don't have. I haven't. Local public health may have that. I mean, I'm not involved directly in the investigation. We know we had a number of organizations there with a fairly significant number of people. I don't have an exact number.
The hundreds, the low hundreds, is there sort of a range?
I don't. I've never been given a firm number, so I'm not going to speculate on that.
Premier, is there a possibility that the province would back down on this vaccine mandate if it believes it might jeopardize healthcare?
No, I think Dr. Strang can speak to this as well, but it's really important that people get vaccinated, especially those that are working around vulnerable people. And we want people to get vaccinated. The mandate is in place. I think when you consider the risk of, there's risks on the other side of changing that policy. And there's a lot of vaccinated healthcare workers who don't want to work with an unvaccinated person, so you'd be at risk of losing people that way. But the overriding risk is, we don't want Nova Scotians to get COVID because somebody who was taking care of them is not vaccinated. So it's not something we're discussing or looking at right now.
I'd like to clarify, sorry. Go ahead.
You said that after November 30th, the province would look to support any sectors that I guess were shorthanded as a result of the mandate. Some people might imagine, though, just trying to steal workers who are already in short-staffed facilities and moving them over to other ones. How do you avoid that, or how do you square that circle?
Yeah, I mean, look, there's already significant pressure on healthcare specifically, so this is not going to be easy. But what I meant with the comment is the local management, the local employers are already looking at scheduling opportunities and how they can move things around. And it could be, we had it during COVID before, in the first waves, that some services had to be rescheduled. We don't want to get there, but so we're really, really hopeful that people will get vaccinated and consider the impact.
Right, you were talking about surgeries there. You said things got rescheduled?
Yeah, some different procedures, different consultations. Even like there's been impacts on our healthcare system by COVID over the last 19 months, 2 years. We don't want to go back to that, but we know that vaccination is critical for the health and safety, and keep people safe is our main goal. So,
I'd like to clarify, just to nail this down. So it's my understanding that if you don't get at least one shot by the 30th, you will be placed on administrative leave. What if I came to you on December 1st and said I'd like to take the education course, or you've taken the education course and I reconsidered? What happens in that case?
We're going to work with anyone. They can. I wish they'd come and do that tomorrow, right? But if it's in December, we're definitely going to work with them. This is not about penalizing people. It's we don't want to have any disruption of service. We want to put Nova Scotians' health and safety first, but we want people to get vaccinated. But for those that need more information, we're going to work with them. We'll do that in December. We'll do that in January. We'll do that whenever is necessary. But we just want to see people on the path towards full vaccination.
You have to get back, except that if you don't have one shot by the 30th, you'll be placed on leave. But you can take action if you are placed on leave.
Yeah, for sure. Yeah.
And the 30th is a hard deadline across all sectors?
Yeah.
I'm going to go to the phone lines. Now. I'll take a question from Nicole Sullivan with the Cape Breton Post. Go ahead, Nicole.
Yes, thank you. This is for Dr. Strang. Here in Cape Breton, there's been a few schools that have had notice of exposures, and one recently listed to have the enhanced health protection measures enacted. A lot of parents are rumbling here with some confusion about what are public health guidelines for when a school is put into enhanced health protection measures or when it goes to the point that the school is actually closed. Can you provide some sort of details about this?
Yeah, it's really when we see we first start out with cases in the school, but there's no evidence of any transmission within the school. That's our first level, and we've had a number of schools with that. When we start to see indication of a transmission within a school, so when we have a secondary case and somebody else shows up, and the only realistic explanation for their exposure was in the school, or when we have a case in a classroom, we test all those classroom contacts. If we start to get secondary cases from that testing, that's at a point where we're saying we now have evidence of transmission within the school. Or if we have had multiple, or if we had an exposure which has, even one individual who's in the school but has been exposed, a number of people from multiple classrooms, and then we have potential, risk of secondary cases in a number of classrooms. Those are the things we look at, that we would move a school from just having a case to needing enhanced public health measures.
Go ahead, Nicole, if you have a follow-up.
Yeah, I'm wondering if you could provide a little bit of information about when the vaccine clinics at Nova Scotia high schools started and why public health moved to that.
So we've been doing some clinics as we've had cases in schools since September. When one of our responses, when we have supporting individual schools and their surrounding community, we bring in our mobile vans, both with testing and in junior high and high school. And unfortunately, we haven't had very many schools of those schools. But when we need to, because those age groups are eligible for vaccination, we also bring in vaccine opportunities along with the testing. In some communities that have had, as we look at local level vaccination data, we've seen, some communities where there's been lower vaccination rates. We've taken the opportunity of using schools as a convenient site to bring in vaccination clinics, and it's not just for students. We invite all of the community to come into the school. So we've also used schools in that manner as well, in certain communities as a convenient and easily accessible place to for the whole community to come and get vaccinated.
Next, we'll go to Chelsea Gould from Saltwire. Go ahead, Chelsea.
Hi there. Dr. Strang, is the exposure notice at Cumberland North Academy and Brookdale related to the faith-based clusters?
I'd have to go back and ask that specific question. It might well be, but most of the cases we've had in the last 72 hours have been related to those clusters. So recent exposure notices are probably associated with that. But I'd have to, I can't specifically say for certainty that specific exposure notice is.
Go ahead, Chelsea, if you have a follow-up.
Yes, thank you. This month we're getting into Remembrance Day and the Santa Claus parades. For places who have opted to do outdoor parades, do you have any messages for people in terms of COVID spread?
Well, we've gotten a number of questions. We're saying we have specific rules around gatherings that are allowed indoors and outdoors. That information and the rules to follow are there. I would certainly one thing to say, if you're like a Christmas parade or any kind of seasonal event, if you can do it outdoors, outdoors is a lot safer than indoors. That's a starting point. But beyond that, it's like make sure you're following what's required and all the measures, and we have lots of information on our website around that.
We'll come back to the room for a couple more questions.
Just on,
sorry, go ahead.
yeah, just on the vaccination numbers for healthcare workers, I just noticed the latest numbers that you just put out. There's been quite an increase among some of the sectors, but the Nova Scotia Health Authority remains at 91% of health work. Is there a particular sector within that number that is problematic? Just wondering why that number is the only one besides the IWK, which is at 99, that has not really changed.
Yeah, Dr. Strang can go on that.
Yeah, I think it's, I mean, we remember, there's preliminary numbers, and, 91% of people who so far have reported I think is a very good number. I think overall, we're seeing of those that we know of that reported, we're having very good vaccine coverage rates. We're still gonna, we have the month of November to get more reporting and to get into more detail. We set a deadline of November 1st for those organizations to report with us. So they're coming in with preliminary data on Monday, and today's Friday. So we've had some, we haven't had a lot of time to get into the details. So we're going to be working with them to explore that by more refined data, whether it's by location, by type of staff, whatever, to get a better, I guess, a more granular picture of what the overall vaccination rates are telling us. Certainly, I know that the health authorities and others are looking at that. We asked them preliminary to report us their overall number, but they're already looking at a much more granular level and where they may need to have prioritize in directing their resources to certain areas to improve vaccination rates.
Is it possible, though, that there are still a number of people who just haven't reported? So when we get the overall reported numbers, those numbers will just drop.
Yeah, I mean, I think there's a big chunk. We're hearing some stories. I heard one from the Premier earlier today, people who are just saying, for whatever reason, I haven't yet reported. So I think a big chunk, we have the month of November. We've got lots of people reported and good vaccine coverage. There's a big chunk who have not yet reported. So we'll be able to, by the end of November, we'll be able to have with much more certainty, like what is that small number who are just not vaccinated versus they just haven't reported their data yet.
So just to clarify, because I thought earlier you said it was the institutions that were reporting, and the people are self-reporting, or?
So they have to report to their employer. Their employer, we have the employer, whether it's Nova Scotia Health Authority, IWK, Home Care Organization, EHS, we've said you need to then report that to the department so we can, and in education it's the same. The individuals report to their Regional Center for Excellence, who reports to the Department of Education.
In terms of in terms of that November 30th deadline, I'm still just hoping you can just clarify what happens after that. If somebody's placed on leave and then they decide they still want to go forward with getting the vaccine, at what point can they return to work? Is it after their first dose, or is it after 14 days after their second dose?
That's one of the details, working out with that's really at the front line with the human resources about that. But we're being very clear that if you're not at least started your vaccine series by November 30th, you will be on administrative leave. How then at the I'll call it the front line, the occupational health, human resources work with those people. As the Premier said, our objective is to get people vaccinated and get them into the workplace. We do have to have some deadlines, and people have to understand what the consequences are if they choose not to be vaccinated. But if people put themselves on a path to get vaccinated, we're going to be there to support the health system will be there to support them to get them vaccinated and get them back into the workforce.
We'll take one more question. Go ahead, Paul. You had a question?
When you say the employees report to their employer, but are they actually showing a vaccine record, or are they just saying, yes, I'm fully vaccinated, or no, I'm fully vaccinated? Like, does the employer just going by their word, or?
I don't know the detail, but we're very clear that it's not just word, that people have to show some reliable proof of vaccination, whatever process the employer has in place for that.
That's all the time we have for questions. Go ahead, Premier.
You guys, everybody good? Ish? All right, thanks everyone. Vaccination. Dr. Strang and I and public health and everyone else will say it as many times as are necessary. If you haven't been vaccinated, please get the shot. Get it today, get it tomorrow. It's as easy as making an appointment at your local pharmacy. It's safe, it's effective. It protects your family, your friends, and your community. So please get vaccinated. And have a good weekend, everyone. Thank you.